So in part one, we talked a lot about kind of applying the system to specific cases like post-surgery, for example. Another thing that's really, really important, so we touched on that in part one where we talked about isometrics through the fingertips, and something that's really, really important, I think, with general exercises that you use anyway, is incorporating the palm and fingers into it quite a bit as well, because it can really change the exercise, and I'm going to show you an example of this now in a minute. So your traditional kind of cuff exercises, you might use, like end stage, let's say rotator cuff repair or something like that. So if you just grab the weight, Sarah, and just do a general kind of external rotation movement first, just normally. Cool. So most people will do just like Sarah's doing now, where they lead with the wrist. So they're pulling back, they're leading with the wrist and just pulling the weight back towards the behind Sarah basically. And Sarah can do that pretty well, no issues. Now, this time, Sarah, I want you to pull through your fingertips. So start the movement from your fingertips, and just your intent with your hand wants to be through your palm and fingers. Nice. Good. And back down. And doing this completely changes the exercise. So now Sarah's got to incorporate all of her palmar tissues, so like her wrist flexors, flexor carpi radialis longus. Feel a bit hard at that, Sarah? Yeah, and you can really feel the difference. Again, try this yourself, get a weight. You'll be able to absolutely blast them out without focusing on the palm and fingers, but incorporate your palm and fingers into this and it really changes the exercise. But now if we think about that functionally, Sarah, so like when we actually need our cuff and stuff to kick in, we're going to grab a kettle, we're going to pick up a weight, we're going to do something, that's when we need to engage our cuff. So the cuff is like a reactive muscle. So we need that to engage as we're doing something through our fingertips in real life. And that kind of helps to replicate that a little bit. Whereas I think a lot of people are missing a trick with a lot of these cuff strengthening exercises where, yeah, we might be stimulating the actual tissues and getting some hypertrophy there, but we're not actually training them that functionally. So, and to be honest, like I tend to use isometrics a lot more than these open chain exercises, but if you are using these open chain exercises, it's really important to consider what the hand is doing and what the palm and fingers are doing. You remember some of those exercises from week 8 as well, Sarah, we're kind of getting onto the palm and fingers. So it's a nice logical progression from there. If we're starting to do some open chain stuff, we're just going to really make sure that we're incorporating all the wrist flexors as well. I think that's especially important these days where people have, tightness here from being on phones, work, laptops, etc. typing. Tissue quality in the flexors tends to be quite poor anyway. So I think getting these involved with these movements, getting them working synergistically with the bicep, tricep and cuff makes a massive difference. Cool, so just a quick recap then of Module 10. So again, there's nothing groundbreakingly new now in Module 10, it's just applying the system to some actual pathologies. And I think we talked about this earlier on, Sarah, it's just actually getting that kind of higher level thinking about things and why you're actually doing it, because it's all well and good learning the content from Modules 3 and Module 8, but then when you get into the real world and have to apply that to an actual patient who's got a specific problem, that's where it takes practice and just some critical thinking, clinical reasoning to help develop that kind of system. So the key points really from this was being able to incorporate your isometrics and things like that into your post-surgical patients who maybe do have a protocol where you're not allowed to load them that early. And then also we've got like engaging the palm and fingers and engaging the fingertips through some of our other external open chain exercises. So we can really change the exercises just by changing the intent of what we're doing with the hand or with the lower limb, what we're doing with the foot. What's your kind of key takeaways, I suppose, from Module 10, Sarah?
It's very, just exactly like I said, pretty much to be the lower limb, like you said, it's the foot pressures and stuff and the weight shift on the hands similar to the feet. Yeah,
definitely. And I think the real key point is just the system stays the same. So no matter what the pathology is, stick to the system, trust the system. If you're running into a brick wall or you're running into problems, it's normally just take a step back and just think higher level again. And I'll do that with patients even nowadays. Where I'll come across a patient, something's not making sense, something you need to sit back, go back to your subjective history, go back to your assessment, maybe tweak a couple of things, look a little bit closer at a couple of things, and you'll get the answer. Whereas I think probably in the early days when I first started, treating this way, when I ran into problems, I tended to go back to what I knew before and go back to the way I was treating before. Whereas as you get better at it and as you practice it, it's more about, okay, this is the system. If I'm running into problems, I've probably either missed something or I haven't asked the right questions and I haven't got the right information. So I think if we can do a good subjective, we can do a good objective, and we can relate that objective findings to the patient's history, we should be able to take them through that system, even in specific pathologies like a shoulder surgery, or an elbow surgery, or a tennis elbow, golfer's elbow. The pathology shouldn't really matter. So next week we're going to go to module 11. So module 11 is your end stage return to play. So this is especially important for sport. So if you're working in elite sport or working in amateur sport, module 11 is really, really important for that. So we've done up to module 7. And module 7 will cover most people in the clinic, you know, that want to get back doing like general kind of just training, things like that. But module 11 is really important for anyone that's going back into like football or rugby or anything like that. Doesn't really matter what level. If we can do this, we should hopefully be able to minimize the chance of them breaking down again when they get back into that environment. So stay tuned for module 11 next week. Any questions on module 10, pop them down below in the comments.